there's fascinating data on what people donate money to in terms of charities related to diseases, and it tends to be charities that do things people consider as unfair. Childhood cancer would be a perfect example because it's perceived as unfair. If you're a child and you have cancer, that's very unfair, so we should give money to that. On the other hand, cardiovascular diseases don't tend to get as much money, even though they're the major killers in our societies. They don't get as much money. Why? Because I think there's this social perception that if people have cardiovascular diseases, it's their fault. They're obese, they don't eat healthy, they don't exercise, they smoke, and so on. So it's quite interesting what people give money to. And I think aging is reflected in that, is that people see, all right, people aged, well, that's fair. It happens to everybody as long as you live long enough. So we shouldn't do anything about it. So in that context, I think what we need to do as a field is show, yes, everybody ages, but aging is ultimately a driver of diseases. And what we're trying to do is make people not develop diseases, because nobody wants to get sick. So we want to prevent people from being sick. We want to make people more resistant to diseases by slowing down aging, and that's the argument we have to make. Because I think at the moment most people don't see aging as a problem that needs to be addressed, in fact, and that's why most biologists don't. I mean, as someone who teaches at university, I mean, lots of my students are interested in cancer. So cancer is certainly the major, the number one thing students are interested in tackling. Why? Because it's perceived as unfair. If you have cancer, that's unfair. And so you want to tackle it. Aging is not perceived as unfair. And I think that's an issue of perspective that we need to change as a field, hence the focus on health, on disease prevention, as opposed to just extending lifespan.